Cancer can play a role in fertility in both direct as well as indirect ways. The direct way is that people with cancer may feel so ill and their treatment may be so dramatic that they simply don't feel like they can try to conceive. Secondarily or indirectly, cancer can play a role because the treatments of cancer may have deleterious effects on the ability of people to become pregnant, either because of effects on sperm and egg or sometimes due to effects on the uterus.
We got married in September of 2006. Then shortly after that, I was diagnosed with cancer.
This is somebody that you plan to spend your life with, and then 2 weeks after you get married, they're diagnosed with cancer, and it's like your mind wanders to the worst.
Although we wanted to start a family right away, we weren't able to because I needed to go through the treatments to deal with the cancer. We chose to just do the surgery and the radiation, and I went almost 2 full years without anything. And then on one of my scans, it showed that it had actually come back.
I stood by her because I love her, and she's my best friend and my soulmate.
So we decided to do radiation. It worked pretty well. We went in and then took out the tumor again. About a year later, we were doing routine scans again, and another one came back.
The standard approach for a woman who is married and knows that she will want to have children would be to do in vitro fertilization right away. Because of the patient's illness, it's usually not appropriate to transfer the embryos at that time, but it may well be appropriate to stimulate her with medications to initiate the IVF process, to create embryos, and to freeze them for implantation at a later time.
So I had already been diagnosed with diminished ovarian reserve before we started chemotherapy, and so I was terrified that I would never be able to use my own eggs. We decided to go ahead and freeze embryos. So we retrieved some eggs and were able to fertilize them, and then had 4 embryos waiting for us. So that was one of the things that really kept us positive through the whole thing, was knowing that we were going to be able to start a family after the chemotherapy, no matter what the chemo did to my body. I did lose my hair, which I was anticipating that, but you're never fully prepared for when you're in the shower and your hair starts to fall out in clumps.
The day we got married, you know, we went through those vows, and sickness or health, you just got to be there no matter what. And in our case, it seems to be more sickness, and I'll be there.
I just can't imagine my life without him. You know, I think of everything that I've been through, and you know, even people that you've dated in the past, and you look at them and go, they would never have been able to do this. Never. And I don't even know that he knew he could do this. So, he's amazing.
Throughout the fertility treatments, I had to be right there with her, giving her shots, being there to go through all the information. Even when we were told we weren't going to have kids, when we were told she had bad eggs, I was right there.
They told us that we probably wouldn't be able to use our embryos for 3 to 5 years. I went to a new oncologist, and one of the first things I asked him was, you know, we have embryos frozen, you know, is there a possibility that we could transfer those? And he was like, you know, I think now would be a great time for you to do that, because, you know, you have a decent amount of time, about a year in between occurrences.
Megan is an example of a woman who was treated for cancer with agents that had a major impact on her ovaries. So it took several attempts to be able to stimulate her ovaries effectively enough that it made sense to go retrieve the eggs. Once we did that and helped develop embryos, the likelihood that any of those embryos would work wouldn't be very high. So we were thrilled that this woman was able to conceive with in vitro fertilization. And outside of that, you see this other circle, and that's one of the first landmarks of a normal pregnancy that we see. It's called the yolk sac. It should be pretty much circular the way yours is. A comprehensive approach to addressing infertility in an individual or a couple really starts with making a diagnosis. Infertility in general is often a couple's problem. At the University of Colorado, beginning 18 years ago, we put our male infertility and female infertility units right next to each other so that we could see couples together. One of the unique aspects of our fellowship is that perhaps it's the only fellowship in the country where gynecologic reproductive endocrinology fellows spend a substantial amount of time on the urology service diagnosing and operating on males with Dr. Meacham. Again, reinforcing the critical connection between reproductive medicine in males and females, because really it's reproductive medicine in couples.